So we also have the role of adrenaline. What does adrenaline do? It's a sympathomimetic. It's fight or flight. It constricts peripheral vessels. It increases heart rate, stuff like that, right? So a lot of the medications that we give are going to counteract the effects of adrenaline. If adrenaline constricts blood vessels and increases heart rate, well, we're going to give what we call beta-adrenergic blockers. Beta blockers, right? And so beta-adrenergic blockers, that's the full name, right? These medications, what they do is they block the adrenaline from activating the receptors, the beta receptors that are all throughout the body in smooth muscles, blood vessels primarily, okay? So that should be your premise, that should be your foundation of what this medication does. You have to remember that they all end in LOL, okay, we got that. But these medications have a lot of nursing implications. Let me explain. Since we're blocking adrenaline, what happens to the heart rate?
Decreases.
Excuse me?
Increases.
If we're blocking the heart rate, if we're blocking the adrenaline,
And it decreases.
it decreases, right? So you must assess the heart rate for a full minute before you give this medication. It should be at least 60 beats per minute. Make sense?
Yeah.
Okay. At the same time, you have to assess the blood pressure because it's going to dilate blood vessels. And when do we not give an antihypertensive? When the BP is below what value?
90.
Below 100, the rule is. Okay, if it's below 100, we hold it. Okay. Same thing with the heart rate, right? People that are taking beta blockers have to be very aware of their cross interactions, their interactions with other drugs. Let me give you an example. People who are taking beta blockers, we're blocking adrenaline, right? Well, what if you have a patient who has diabetes mellitus? Diabetes mellitus has nothing to do with this right now, right? But when somebody has hypoglycemia, low blood sugar levels, your body needs energy, so it activates the fight or flight mechanism so you can get energy when you have low blood sugar levels. Does that make sense? Mm-hmm. So that means that when you have low BS, low blood sugar levels, hypoglycemia, your body activates the fight or flight mechanism. The fight or flight. That means that adrenaline is activated. But if your patient is diabetic and they have hypertension also, and they're taking beta blockers, it's gonna what?
Lower their blood sugar?
No, it's not gonna lower their blood sugar. It's gonna block adrenaline from showing the manifestations of hypoglycemia. Because remember, hypoglycemia, the signs and symptoms that you get, the tremors, the shakiness, the nervousness, the tachycardia, all that stuff is brought upon by the activation of adrenaline when you have low blood sugar levels. You have to establish that first. Does that make sense? So now you have a situation where your patient's diabetic. We know they might develop hypoglycemia because that's one of the things that could happen, but they're also taking beta blockers. Well, if you're taking beta blockers, you're blocking the adrenaline that's giving you the signs and symptoms of hypoglycemia. How do you know if your patient is developing hypoglycemia?
You don't.
You don't. It might mask it. So you have to assess the glucose on this patient more frequently. You have to be observing the patient more frequently because it may mask the signs and symptoms of hypoglycemia. Does that make sense, guys? Mm-hmm. That's something you guys need to know. Another thing is that this medication blocks off the activation of adrenaline to the smooth muscles, which include your airway. And because of that, people with beta blockers, they can also develop what we call bronchospasms. Bronchospasms is an adverse effect that this patient may develop. So you have to take precautions when giving beta blockers to people who have bronchitis, asthma, respiratory issues, because it may cause bronchospasms, and that can, of course, impede the airway. Impair the airway? Does that make sense, guys? Okay. Yeah, that's it for now.